they do at the end to Cyndi Lauper time after time, and she did it with her daughter, so it was like the same dance. It was so good. So good. Okay. All right, happy Friday. Yay. I will get your exams back by Monday, hopefully. I don't want to promise anything because, but I'll try. I'll try my best to get them to you by Monday. If not, for sure, Wednesday would be the latest. I haven't created the assignment yet in Canvas, but your lab report will be due on Wednesday. So for both the identification of your own enteric and the identification of the unknown mixture that I gave you, you can either write it as one large lab report or you can write it as two separate lab reports. And I'm only going to create one assignment in Canvas. So if you create it as two separate lab reports, you're free to upload it as the two separate documents, or you can have like lab report 1 and lab report 2 in the same document if it's giving you fits to upload both. So I'll create that assignment. I'll try to remember. I have an advising appointment right after this, so I'll try to do it right after that so you can see it. And again, you can submit however you want. So on Monday, before the exam, when we left off, we spent time talking about diarrhea, which is always fun at lunchtime. But today we won't, so I'm sorry to disappoint. The first viral group that we have today are the Paramyxoviruses. So these are enveloped, and they are negative sense strand RNA viruses. So that implies, I think this might be the first negative sense strand RNA viral family that we've had. And so that's tricky because with our positive sense strand RNA viruses, right, positive sense, this is basically mRNA, right? So as soon as it gets into the cell, it can immediately be translated. So positive sense strand RNA viruses don't really have to bring any extra machinery because their genetic material can be translated. They can encode their own polymerases, but they don't have to bring them along. Now, when you have a negative sense strand RNA virus, it's the opposite, right? The translation machinery, the ribosomes don't recognize it. So the virus can't really do anything because our cells don't know what to do. Our cells can read mRNA. They can make proteins. They're pretty good at it. Our cells can take DNA, transcribe it to RNA, translate it to proteins. They're pretty good at that too. We don't know what to do with this. So when we have a negative sense strand RNA virus, this virus has to bring its own machinery. So the previous cell that it infected had to make a protein for it. And that protein is called an RNA-dependent RNA polymerase. So an RNA-dependent, it reads RNA, RNA polymerase, it makes RNA. So this is a weird type of polymerase that we don't have in our cells because we don't do this. We don't take RNA and make more RNA. So any of our negative sense strand RNA viruses are going to have to bring, and it's listed down here, their own polymerase with them. So again, it's a challenge for the virus, but it could also provide a target for an antiviral therapy because it's a unique protein that we don't make. And if we're able to target a unique protein that we don't make, in theory, we shouldn't hurt ourselves. So, there's a medicinal application for this basic biological knowledge of the virus itself. So that's why I emphasize that, because I know normally we care more about what are the symptoms, what is the treatment? But why does the treatment work? It's because of that. Okay, so there are 3 genera in this viral family that cause human disease. I'm not going to ask you to remember those names. Okay, I'm just letting you know that they're there. And one of the things that they do in terms of CPE that makes it easier to diagnose is they form those syncytia, right? Those giant multinucleated cells. And like a lot of our enveloped viruses, antibody responses are not as important because with that envelope is mostly host-derived. There are a handful of viral proteins that will be embedded in that membrane, but for the most part, it's host-derived. So antibody isn't terribly important. Cell-mediated immunity is. But what we'll see when we talk about the first virus in this group is that when you have that cell-mediated immunity, right, that destruction of infected cells, that causes a lot of your symptoms, but it also is really important for clearance. So if we have patients who are immune compromised in that they are T-cell deficient, basically, if they're T-cell deficient, they don't usually have a lot of symptoms from these viruses, but they also can't clear them either. And these, as a family, are transmitted by respiratory droplets. Again, I don't ask you to remember all of the steps of the replication, but I'm trying to show you right here, you have that RNA that has to be transcribed into a template for translation. So these negative strand RNA viruses just have to do that one extra step before they can start making their proteins. And they have to bring that polymerase with them. Okay, so when they move in, they bring something with them. Okay, the first group, or the first virus in this group that we'll talk about is measles. So we've all, I think, heard of measles. Hopefully we've all been vaccinated against measles. I'm not asking, so you don't have to tell me, but I'm just, hopefully. And so I am of an age where I remember when measles was a disease that we considered to be eliminated in the US, and that was around 2000. I'm showing you the most recent data from the CDC that measles is not eliminated in the US. We still are having cases and outbreaks. So measles is one of those that, again, a lot of people experienced in childhood. My dad is one of those people that he likes to play devil's advocate. And so I was talking to him about vaccines once and about measles specifically. He was, well, I got measles and I didn't die. And I'm like, well, I mean, I've been in a car accident and I didn't die. It doesn't mean like it's something that we want to do. And so what we run into in a situation is we have people who had measles and survived, but we also have a whole generation of people, or maybe a couple generations of people, who never knew anybody like as a contemporary who had measles. And so we don't remember what these diseases really do. One of the last major outbreaks of measles in the US was in, or prior to this, was in the late 80s, early 90s, where 123 people died, and they were mostly preschoolers, so children under the age of 5. In California alone, there were 16,000 cases and 75 deaths. So it is an infection that can be very dangerous. Is the mortality rate as high as some of the other infections we've talked about? No, but it is there. And so what we've seen with this decrease in vaccination and or vaccine hesitancy even in the US is we've started to see measles cases occur relatively regularly. There are a couple of big peaks that you're probably seeing on this graph. One of them was in 2014. Does anybody remember where that came from? The happiest place on earth. Disneyland. Yeah. So this was associated with an outbreak at Disneyland. Because in other countries, measles is more common than it is here. They don't have access to the same healthcare that we do. It may be more difficult to get people vaccinated. So there was at least one infected traveler that came to Disneyland, and other unvaccinated people at Disneyland got the infection and traveled throughout the country. So that's mostly associated with Disneyland. This 2019 is an even bigger outbreak. This was the biggest one since here. And what we were looking at was, again, a traveler brought it into the US, and it spread through the unvaccinated Orthodox Jewish community, mostly in New York. So New York was the state that was mostly affected by this outbreak. And what you have are physicians who will sometimes see these first cases who don't know what they're looking at, because measles is not a disease that they should have learned about. It was considered eliminated. Why am I worried about a measles patient turning up at my clinic in Turlock? When you have that decreased vaccination and you have these increases in infection, that's a problem. And so again, these are some of those headlines, some from the US, Brazil, Europe, Portland. Ooh, one of our colleagues is in Portland right now. I'm not going to tell her that one. Okay. This was just from this year, earlier this year, up to 20,000 people who attended a religious gathering may have been exposed to measles. So the thing with measles that makes it so dangerous, have any of you seen the movie Contagion? Yeah? Sounds familiar? Kate Winslet plays a detective. Well, not a detective, but she's with the CDC. She's like a disease investigator. She's an epidemiologist. And she goes to, I think, Minnesota, where they're having an outbreak of whatever disease it ends up, like the bird pig flu, bat pig flu, something like that. And she talks about how an infected person can infect a certain number of uninfected people. Well, measles is one of the most contagious infections. One infected person with measles is expected to infect more than 10 uninfected people. So it's very, very, very contagious. And again, transmitted through respiratory droplets. So it would be sensitive to drying out, but we all know that we get lots of infections that are enveloped, that are transmitted through respiratory droplets. With measles, the major symptom that you're going to see is a rash, just like chickenpox, just like Rocky Mountain spotted fever, just like all of these other infections that cause a full body rash. And so a physician isn't always going to think measles when someone comes in. So those of you who are going into medicine, you really want to think about, well, what diseases can cause a full body rash? And how can we differentiate them based on symptoms, based on history, and based on different tests? Generally, what you're looking at is, because it's respiratory, it will replicate locally, go viremic, and then spread to other tissues, including the skin. And it's that T-cell mediated cell death in the skin that's causing things like the rash. Did you have a question?
So the rash would be full body, not located in a specific area?
Yeah, it's gonna be full body.
Oh.
Yeah. And then one of the things to highlight down here as well are these kind of rare outcomes. So when you have a patient who's gotten measles and dies during the acute stage of the infection, it's often they either had defective cell-mediated immunity, they can't clear the infection at all, and eventually the viral replication in the host cells will cause enough host cell death that the patient will die. Immediately after the infection, patients can develop encephalitis. And the one I like to tease my dad about, because my dad says, well, I got measles and I'm fine. I always say, for now. And I don't wish bad on my dad. Of course, I love my dad, but he plays devil's advocate, I play devil's advocate. We have a good time. Some patients who have survived the initial acute infection with measles can develop a secondary complication that we call subacute sclerosing panencephalitis. It's a mouthful, SSPE, as an abbreviation. And what happens is the virus has gotten into the central nervous system, and it can be reactivated decades after the initial infection. but the replication isn't done totally correctly, so it's making defective viral particles in the CNS. And that's what's causing those symptoms of encephalitis. So it's rare, but again, if I can't tease my dad, what's the fun in that? Okay, so I'm going to tell you, if you have a patient who turns up with a full body rash, and you're not sure, chickenpox, measles, Rocky Mountain spotted fever, allergic reaction, one of the hallmark symptoms of measles that we don't see with some of those other conditions are called Koplik spots. They're white spots in the mouth. So you'd want to look at your patient's mouth and see if they've got those white spots. It's pretty classic. Okay, so again, one of the most contagious infections, more than 10. The estimate is anywhere 12 to 18. So if one person in this room had measles and we were all unvaccinated or unprotected, we're probably all going to get it. I'm going to be real mad at whichever one of you brought measles to the classroom. Okay. In a household, again, the majority of exposed people who are also susceptible will become infected. We've already talked about the information in the box, so you can read that at your convenience when you're studying. But here again, you've got the full body rash. How is it different from any other full body rash? Generally by looking in the mouth. I know it's not easy to see on the projector, but you've got those white spots in the mouth, those Koplik spots. So chickenpox won't do that. Spotted fever won't do that. Generally, like an allergic reaction or any other infection, you don't see that. That's pretty diagnostic. Okay, so this is a case of measles in an immune-compromised child. So I told you that the cell-mediated immunity is really important to clear the infection, but it's also one of the things that causes the majority of the symptoms. So when you have a patient who doesn't develop symptoms, how do you know that they have an infection? And how do you start to treat it? So in this case, we have an exposure to measles with a child who's undergoing chemotherapy for ALL, acute lymphoblastic leukemia. It's a common childhood cancer. Remember, with chemotherapy, that wipes out your immune system. So whether or not this child has been vaccinated, the history is not important because the current chemotherapy removes the immune system. Despite antibody therapy, 23 days after exposure, she eventually did develop a rash that became hemorrhagic. So remember, the virus itself can cause tissue damage. And now it's causing tissue damage and not being able to be controlled by the immune system. So it's causing tissue damage in the blood vessels as well. She had a fever, she had pneumonia, measles was grown from the nasopharyngeal region, and looking at the cells under the microscope, they saw the syncytia. They stopped chemotherapy, and she received massive doses of immunoglobulin, so preformed antibody. She started to improve 1 month after the onset of the rash. Another case, there was a boy who was doing treatment for the same type of cancer for 2.5 years. He suffered severe herpes simplex infections around his mouth, and then herpes zoster on the trunk. Y'all remember what herpes zoster is? It's chickenpox, right? Shingles. Yeah, very good. After 19 days, let's see. He was exposed to measles from his sister, received IgG. After 19 days, developed respiratory symptoms, but no rash. Remember, he's on chemotherapy. So he's not gonna develop some of the same symptoms we would see in somebody that has a healthy immune system. 29 days, he refused to go to school and misbehaved, which I'm like, that sounds pretty normal for most kids. And one with cancer, I'd be like, I have cancer, I'm not going to school. Are you kidding? But they called that a behavioral change. After 9 weeks, he developed seizures, increased drowsiness, slurry speech, confusion. Okay, this is a problem, right? A kid not wanting to go to school, but all of these other things taken together, that makes it an issue. And unfortunately, this progressed to coma and death within 8 days of the onset of seizures. He didn't have any antibodies to measles. Autopsy indicated the presence of cytomegalovirus. Remember that one? Good. but not measles in the lungs. The brain showed extensive degeneration, but no virus was isolated from the samples. Lots of inclusions and structures that resembled measles nucleocapsids in the cytoplasm. So this patient, unfortunately, had developed that subacute sclerosing panencephalitis, where he's not making the appropriate measles virus, he's making defective measles particles in the central nervous system. And so in this patient who was immune compromised, it progressed to the brain and was able to cause that symptom that we normally see very, very rarely, generally decades after exposure. So I hate to harp on you about vaccines. Actually, I don't hate it. It's part of my job. Vaccines are super important, not just to protect you or your family, but to protect those patients who can't be vaccinated or who don't have immunity anymore. And there were, as far as I remember, with that measles outbreak at Disneyland, there was one death. It was a cancer patient in Seattle who died of measles because she'd come into contact with somebody who got measles from Disneyland. Okay, so you're protecting, the community as a whole. The symptoms are characteristic for the diagnosis. You just have to remember that complex spot. You can use the reverse transcription PCR. You can use immune assays. And of course, you can do microscopy. You're looking for generally the Syncytia formation. And we do have a vaccine that, again, you should recommend to your patients for the most part. Not everybody can be vaccinated with this vaccine because it's a live attenuated. So who would we not want to vaccinate against measles? Immune compromised. So if you have a patient who is genetically immune compromised, you may want to not vaccinate for measles because this is a live attenuated. It can still replicate, but in a healthy individual with a healthy immune system, they should be able to stop the infection. What you can do if you do have a patient who's immune compromised that may have been exposed to measles is do that antibody therapy, the preformed antibodies, and you can give them those to help, like try to stop the infection. The other challenge is because the disease is so contagious, one person can infect so many other people. In order to have really effective herd immunity, you have to have 93% or greater of the population be vaccinated. So in areas where that dips, that's where you have a lot of risk. Okay. And there are spots in California that have very low vaccination rates against measles. Marin County is one of the examples that I'm thinking of. At one point, the last time I looked, it was like 50% were vaccinated. So, just watch. They're all going to get measles one day. And I don't wish that on anybody. I don't think it's great, but...
Can you get measles more than once?
Theoretically, no. No. And you shouldn't be able to get measles if you've been vaccinated. The vaccine works really well. What can happen would be a situation where maybe you were vaccinated and for whatever reason you didn't mount the immune response. You could definitely develop measles that way. Or if you had like these patients where maybe you were vaccinated in childhood and for whatever reason you became immune compromised, chemotherapy, illness, you could get it then.
Yeah. Is measles one of those like with chickenpox where it's better to get it when you're younger, or does it not matter?
Well, so it's kind of a pro and con, right? So like with Epstein-Barr was one too that we talked about where maybe it would be better to get it in early childhood because you wouldn't develop such severe symptoms. So with measles, children generally have a weaker immune system than a young adult or an adult. So they may not develop the significant symptoms like the big rash and everything. But at the same time, if they don't have the robust cell-mediated immunity to clear the infection, you could have those secondary neurological complications. Yeah. This is one, like chickenpox is more mild than this. So this is one where I'd be like, I guess if you're really, for whatever reason you have to do Sophie's choice of like which vaccine you're gonna get this one. But get all of them, yes.
Is if you get measles and then can you still get the vaccine to like prevent the secondary like future?
Ooh, that's a good question. So I know we see that with chickenpox, where somebody who's had chickenpox can get vaccinated and hopefully not develop shingles. I don't know. I'm thinking that because the subacute sclerosing panencephalitis, that really dangerous but really rare secondary complication, produces defective viral particles, I don't know if the pre-existing immune response from a vaccine would be able to stop it, because the viral particles they're not the same. Yeah, because they're different. Yeah, and I haven't read any studies about that. That's a really good question.
Sorry, no question. But,
No, please.
If the T cells aren't working properly, I'm assuming you're still contagious to like others, like even if you're not showing symptoms.
Yes. Yeah. Definitely. Other questions about measles? So this is the MMR vaccine, measles, I'm not going to put the mumps slide up just yet because it's gross. Measles, mumps, and rubella, right, is that vaccine that you get together. And this is one that got a lot of bad press because people said that it causes autism. It doesn't. We could have a whole discussion about why it doesn't. But one of the things that people said about it was that it contains this compound called thimerosal, which is a mercury-based compound, and that was what was causing people to have autism once they'd been vaccinated. This vaccine actually never contained that compound, ever. There are other vaccines that have, and may still do, but not the MMR. So, when you are working in a healthcare setting, you definitely have to be cognizant that people might have different beliefs and different opinions, and you can do the best you can to be compassionate, but also fact-based about how important it is to be vaccinated against these illnesses, and that they're not going to get, their children won't get autism from being vaccinated. Okay, this is why I didn't want to put the mumps picture up right away. So mumps is the other infection that we get vaccinated for in that same combo. Generally, mumps is pretty mild, and the symptom that most people see is shown here. So I don't know if y'all follow hockey. I don't really follow hockey either, but this is apparently a very famous hockey player. It's not Wayne Gretzky, so I don't know who it is. That's the only hockey player I can actually name. No, his name is Sidney Crosby, but I couldn't tell you anything else about him. But mumps went around a couple of the National Hockey League teams a minute back. It's been a few years. And you see that swelling. It's swelling of the salivary gland. So that's the really common symptom, is swelling of the salivary glands. So they call it mumps. But you can see that it also can cause swelling in other glands. So it can cause swelling in the testes, and it can get into other organs as well, including the thyroid, the pancreas, in ovaries, and it can also get into the central nervous system. So in terms of, is mumps going to kill you? Probably not. This is not nearly as dangerous in terms of a life-threatening illness like measles could be. But what we can see, because of the swelling in the testes and the ovaries, you can have fertility impacts all the way through like permanent infertility. So it could, if you wanted to have children and you were no longer able to because of a mumps infection, it could very negatively impact your future. So we try to prevent that as much as possible. It's also hypothesized that because it can affect the pancreas, that it could have been correlated with or a causative agent of, not the only, but a causative agent of the onset of juvenile diabetes. So again, diabetes can definitely be life-threatening, and it would certainly impact the rest of that patient's life. So if we can prevent that as much as possible, that's great. In rare cases, if it causes a significant infection in the CNS, you can see like meningitis and encephalitis. It's a lot less common, but it is possible. So again, It can be often asymptomatic. The majority symptom is going to be the swelling of the salivary glands. And of course, the swelling in the testicles can lead to sterility. You can recover the virus from the saliva, the upper respiratory tract, etc. You can diagnose the infection through, classic mechanisms, reverse transcription PCR, ELISA. Somebody came in with giant swelling in their salivary glands. Right? So symptoms can sometimes be very diagnostic. There really isn't a whole lot that can cause that. Vaccination is the only effective prevention. The mumps vaccine is not quite as effective as the measles vaccine, so we still do see, even in vaccinated populations, I guess what we would call breakthrough cases of mumps. So sometimes the immunity to mumps can wane a little bit, and you can still see that even if the patient had previously been vaccinated. And so that's why if we look at the cases, we see far higher numbers of cases for mumps than we do for measles. Mumps was never considered eradicated in the US, but cases have gone down significantly. Okay. Yes.
So like if you get mumps, there's no treatments they can give you, so you just have to wait in case the your body fights it off.
Basically, yeah.
They would just give you for the swelling?
They could definitely prescribe anti-inflammatories to help reduce swelling. If you had severe symptoms, maybe, swelling of the testicles or, potential meningitis, they may prescribe something like a nucleoside analog to try to help reduce viral replication and help the body clear the infection. But for the majority of patients, it's good luck, wait it out, Yes.
So is like infertility, it's typically correlated with if you had any swelling in like your ovaries or testes, or it can also like be asymptomatic?
So generally, if mumps is causing the infertility, you were going to have the symptoms. So you would have that noticeable I guess I don't know how you would know that your ovaries had swelled. They're not generally visible from the outside. Probably you would have the pain associated with that, and it could be diagnosed through a CT or an abdominal scan. The swelling in the testicles is going to be more noticeable, and generally you have to have that really severe swelling in order to lead to the fertility loss. Yeah, just because a patient may develop swelling doesn't mean they'll necessarily develop fertility, but it is associated. Yeah, and so, I just wanted to show you this again because a lot of you are talking about going into medicine. The recommended vaccine schedule. And so we see, your MMR, measles, mumps, and rubella. The first dose is recommended anywhere from, 12 to 18 months. So I'm highlighting this because you have a patient population, children under the age of 1, who have no real protection against a lot of these infections. And so that is also why it's important that we maintain that herd immunity. We all, kind of think of this idea of, you can't vaccinate immune-compromised people, so they're going to be at risk. But infants also aren't vaccinated, so they would be at risk as well. So you want to protect the general population. Did you have a question? Nope. Okay. Okay, so I want to pause here, and we're going to play Turlock General Hospital again. Okay, so Turlock General Hospital, you all remember the rules, sort of? Okay, I am a patient. I will tell you about how I'm feeling in just a minute. And you will have 5 minutes to ask me more questions. And then you'll have 2 minutes to decide what tests you want to run for what particular infections. And so I randomized the roles. I don't know if everyone is here today. Oh yeah, okay, cool. Simran, you're the timer, 5 minutes. Donna, my accountant. Jose is not here, and neither is Caesar. So, Juan, you are my senior resident, and Halima, you are my attending physician. Okay, so remember the senior resident is going to help make sure that everybody gets their voice heard. Am I attending? Halima, you're my attending. You get to make the final call because you're the boss. Okay, so Simran, are you ready? Okay, so once I stop my explanation of who I am, that's when you get the 5 minutes to continue to ask me questions. Okay, I am a 16-year-old female. I've turned up here with my mom, because I'm 16, so I had to bring my mom, and I have a full body rash. So it's weird, right? Like to have a full body rash. And like I feel kind of tired and achy, but like the body rash is like really tripping me out. So my mom brought me to the hospital because I feel weird. That's it. That's all I know. 5 minutes. So you want to ask me questions?
Wait, the rest of us get to ask.
Everybody gets to ask questions.
Okay.
Wait, can I ask a question?
You can always ask a question.
Was it mumps?
Mumps. How's it spread?
Yeah, how is it spread?
Respiratory.
Respiratory droplets. Yeah.
All of them are, right?
Yep.
Oh,
You said you got a fever too, right?
I have a fever. It's not like really high, but it's a little bit of a fever. Yes.
Do you have white spots in your mouth?
Do I have white spots in my mouth? Yes.
Have you been in contact with like any rodents?
Rodents?
Yeah.
Ew. No.
Okay.
Actually, as a 16-year-old girl, I thought rodents were cool, so I don't know. Sorry. No, I haven't been in any contact with rodents. Dogs? Yeah, I have a dog. He's a miniature dachshund. His name is Barney.
It can be anything. Yeah, it can be anything.
What else do you want to ask me?
So chickenpox? Any fever?
Yeah, I have a fever. It's not super high. It's like 100.1. I don't feel good. I just don't feel good. But like the rash is the thing that's really bothering me. Because it's ugly. And I don't want to go to school. Yes.
Is it itchy?
It's not really itchy, no.
Is it a full body rash?
It's a full body rash.
Does it look like a bullseye?
No. And when you ask those questions, I always want to tell you, no, it's not this. No, it's not a bull. It doesn't look like a bullseye. It's just like, it's like little red spots all over my body. Yes.
Do you have swollen glands?
Do I have swollen glands? No.
Are the viruses that have been completely, well, they're not in the population anymore, are those on the table for this 2-hour general hospital?
Smallpox is not on the table. Ask me questions.
You said full body rash.
Full body rash. How much time do we have left? 2 minutes and 30 seconds. Any? I haven't changed my soap or anything. No, I'm not using anything new. No new detergent. Mom, do we have new detergent? No new detergent. My mom does my laundry for me. Yes.
Have you been hiking recently?
Have I been hiking recently? Yeah, we go camping all the time. Like, it's really fun. What other questions do you have for me?
Does your dog have ticks?
Does my dog have ticks? Oh, no. My parents take him to the vet and they get this like pill that they give him to keep the ticks away. Yes.
Has this been happening all of a sudden, or has it been building up over a couple of days?
I mean, I've had it for a few days.
Did the rash came after you came from hiking, or was it before?
Well, the last time we went hiking was over the Labor Day weekend, like because we had the 3-day weekend, we went camping. And it only came up a few days ago.
Okay, I was thinking that, like,
What
before.
can we ask? So,
Ask whatever you want.
So she had kind of full body rashes. This one only comes with women
Did you go swimming? Did you get into the water?
Yeah, we went swimming. It was really hot that weekend. Yeah, Labor Day weekend. You know, like the first week of September. It was really hot still. Okay, I will give you a grace if you have one last question you'd like to ask me. Does anybody have a last question? It's like you're marching to your doom or something. Like, last questions? Questions?
Did you get any cuts on your skin? Or?
I got a cut on my foot when we were swimming because I was like jumping into the water. So I like hit a rock. Yeah. Okay, now I've been here long enough. My mom wants to go shopping. So actually, if I was with my mom, that's what would happen. She would want to go shopping. 2 minutes to talk amongst yourselves about what tests you would like to order to diagnose my infection. And, oh, I don't know why that's not, why did my screen go to sleep?